If you're a breast cancer survivor and wondering whether or not you should be going on medications like tamoxifen or letrozole, this video is for you. I know this is something that a lot of women struggle with. I know my patients and my clients have had multiple conversations with me around this topic, and it's all because of the potential for side effects with these medications, but also because women are on these medications for such a long period of time, sometimes 5 to even 10 years. And so the concern is valid, but what I wanted to do today is discuss 4 key things that you should be asking your oncologist to know whether or not you should be going on these medications and to help you feel more informed and empowered as you make that decision for yourself. The other question that I'm going to be answering today is all around whether or not there is a natural alternative to tamoxifen or letrozole. I'm going to be sharing with you the data and the research and discussing this a little bit further with you as well. But before we get started, welcome to the Thrive Beyond Cancer YouTube channel. I'm Dr. Becky ND, a board-certified and licensed naturopathic doctor, a cancer coach, a cancer survivor of over 28 years, and a mom of 3 beautiful girls. Before we get started, please make sure to subscribe, like, and also hit that bell button to get notified when new videos like this get posted. Let's get started. So the question you might have in your mind right now is, should you take tamoxifen or an aromatase inhibitor like letrozole? If you have a breast cancer that's estrogen receptor positive, that means that these medications could potentially be meaningful in terms of reducing that recurrence risk. And this is a conversation that's best had with your oncologist, who actually knows your case the best and can help to answer some of these questions. But today I wanted to share with you 4 key questions that can really help you make an informed and empowered decision on whether or not you want to go on one therapy, continue the therapy, or which therapy you want to do, because sometimes oncologists will actually give you a choice. We're only discussing 4 key questions today, but feel free to comment below and let me know what sort of questions you felt were really helpful and meaningful to you, and hopefully that will help someone else too. So the first question that I would ask is, what is a rough or estimated absolute percentage benefit? So this will give you an idea of what the benefit is for you specifically to take the therapy versus not taking it in terms of recurrence prevention. It also means you can weigh for yourself whether you think this percentage benefit is enough for you to try or start or even continue. And so for some, a 1% benefit may not feel meaningful enough to continue, while for others, this may be big enough to even try. The second question you should be asking is, what are the side effects or potential side effects that you could get on any medication that is decided for you or that you decide alongside with your oncologist? Now, this is important to note because it can help you to weigh the benefits versus your risks. So, for example, some side effects include bone and muscle aches, hot flashes, gut impacts like nausea and vomiting, vaginal dryness, fatigue, sleep issues, hair thinning, and one thing a lot of women often don't know is actually weight gain. And there are also more serious potential side effects like heart disease, increased risk with things like aromatase inhibitors like letrozole, and increased risk for osteoporosis. And with tamoxifen, while it is a really rare occurrence, it may increase risk for things like uterine sarcomas or endometrial cancers. So you need to know these so you can ask for further testing for symptoms like abnormal bleeding or discharge or unusual pelvic pain and pressure or pain during intercourse and so forth. And also important for you to know that even though these may increase risk for things like uterine or endometrial cancers, there are many things you can do to help decrease risk for even things like this, like maintaining a healthy weight, eating a healthy diet, exercising, and controlling diabetes. For osteoporosis risk, things like your diet, like making sure that you have enough protein and weight-bearing exercises, as well as supplements like calcium and vitamin D, can be important to not only help prevent, but also reverse loss of bone density. And this is true with so many side effects. Even though these medications can cause different side effects, there are still many natural strategies like your diet, your lifestyle, supplements even, that can actually help to reduce their impact. Another really important question to ask your oncologist is, what is the full plan? Will you be on this medication for 5 years or 2 or 3 years? Is there a switch in mind? What other medications will you be on? So this can be important because it can give you a timeline and set expectations, as well as when to expect a change and a switch up, or what other options you actually have, and then be able to decide between those options. For women who are not yet in menopause, there are other certain medications that may be needed to force you into menopause for you to be able to take certain medications like aromatase inhibitors, for example, which also may have side effects of their own. So understanding your entire plan is actually really important to help you feel more empowered through it as well. The last and really important question that I wanted to include today is, what is your survivorship plan? So moving forward, what should be monitored? What should you be prioritizing? So for example, if you already have osteopenia or osteoporosis, or essentially thin bones, or you have a family history and you're recommended something like an aromatase inhibitor like letrozole, we do know that getting your bone density testing as a baseline first, and then continuing to get it tested in the future to ensure that we don't have to bring in more strategies, for example, is really critical and important here. We also know that working on bone health strategies to help build up your bone and keep them strong is really important to do as a preventative as well. So it's also important to note that if you're on these medications, you may be at higher risk for more severe menopause symptoms, heart disease, diabetes, high blood pressure, high cholesterol, and thyroid issues. In fact, there are so many different studies, but one study published in 2022 showed that adult cancer survivors may have a 42% greater risk of heart disease than people without cancer. So there is something unique about cancer survivors and their specific needs. So all of these should also be monitored. Things like your cholesterol, your blood pressure, your blood sugar regulation, like your fasting glucose levels or your hemoglobin A1C, for example, are things that should be monitored either through your family doctor or someone like a board certified naturopathic doctor. Here in Ontario, this is something that I help my patients with, especially those who don't have a family doctor put in place already, because there has been a lack of doctors around. But these strategies are really important. These blood work that you do on a regular basis can also be really critical and important as well. Heart disease, we also know, is actually the leading cause of non-cancer related deaths among cancer survivors. So this is again why your survivorship plan has to extend out to more of a health plan for yourself that encompasses a lot of different things. Yes, the potential side effects of these medications, but also the uniqueness of your situation as a cancer survivor and what your needs might be in order to optimize your health beyond just cancer prevention, but also in prevention of other diseases potentially, and optimizing your health as much as possible. The last and really important question I wanted to tackle in this video today is a question I get asked really often. And oftentimes it's because there's so much fear around tamoxifen or things like letrozole, or maybe you've already tried it and the side effects have been really bad and you're really unsure how to move forward. The question is all around, is there a natural alternative or a natural substitute that works just as well as tamoxifen or letrozole? And it's a really great question. And the thing is, there are certain studies just like these that have shown that natural products may have some aromatase inhibitor action as well as be able to help in terms of the prevention of breast cancers. But here's something really clear and important to note. Unfortunately, even though we have a lot of these studies showing some beneficial factors potentially from these natural compounds, there are no head-to-head studies, which we absolutely need in order to be able to say that a natural compound could work exactly like a tamoxifen or letrozole, for example. Most of these studies on natural compounds are also done in vivo or in cell lines or in vitro in animals. So there's none that is comparable that we can say that shows us at this time that they work exactly the same way as these medications, even though they may have similar types of actions. So for example, components found in things like green tea, mushrooms, and others have been shown to have some aromatase inhibition qualities. So yes, could we incorporate more of these types of foods, for example, to our diets? Yes, absolutely. But to say that they're alternatives would not align with what research is telling us. What we do know is this very clear sentence here from one of the studies. However, the clinical evidence supporting the efficacy and safety in breast cancer treatment is inadequate. We do not know how much would be enough. We don't know all of the potential side effects for that particular dose. We don't know when it would be best to be taken with. We don't know if there are other potential interactions at that dose that would be needed. There's so many different questions that we still have to answer to truly be able to say that something works just equally as well as a medication that currently exists that we already know could be helpful for many women in terms of reducing their recurrence risks over time. So this is a answer right now that we have based on the research that we have currently available. But certainly, could things change in the future? Absolutely. We just don't have enough data and supportive data to say that is a substitute that's natural that could work exactly the same way as a medication at this time. Before we end, I just have two last thoughts to share with you. And the first one is that you can have multiple conversations with your oncologist and your healthcare practitioners throughout the years to really help you through this process. The other thing is, this is a really key and important time where your lifestyle and your natural strategies are actually really important to not only help reduce those side effects, but also to boost how these medications work and how you're able to reduce your recurrence risk. So hopefully this was helpful to you, and I'll see you in the next one.